Saya bekerja sebagai seorang setiausaha di sebuah universiti awam. Kahwin tahun 2000. Selepas 2 tahun tidak memiliki cahaya mata, saya buat check up dekat klinik dan doktor mengesahkan saya ada diabetik masa tu. Keadaan diabetes saya sekarang dah tahap kronik lah, sebab saya dah menjalani proses dialisis, and then mata saya sebelah dah buta. Mata ni tinggal dalam 6%. Mula-mula saya didiagnoskan diabetik tu sebagai seorang yang muda. Masa tu umur saya 26, 7. Saya tak boleh terima. Jadi saya ambil masa 10 tahun untuk membiarkan, tidak mengambil ubat, tidak ambil apa-apa rawatan dan sebagainya. Sebab saya sihat, saya seorang yang sangat energetik, saya seorang yang sangat aktif. Jadi saya rasa macam itu saya tak percaya. Saya in denial. Takkanlah orang normal boleh buta. Dia jadi macam tu. Pertama sekali saya kesihankan suami saya. Saya sangat kesihan dia. Dia terpaksa menjaga saya. Dia tak boleh bekerja kerana menjaga saya. Dia terpaksa lepaskan kerjaya yang waktu berjabat dia, sebab dia kena menjaga saya, nak ambil saya pergi dialisis, ambil saya pergi hospital, appointment hospital dan sebagainya. Dia tak boleh bekerja waktu berjabat lah, so dia kena buat kerja-kerja yang sampingan yang lain. Sangat kesiankan dia. Marah tidak, kecewa tu sangatlah, sebab saya banyak lagi benda nak buat. Saya nak tengok anak-anak saudara saya membesar. Saya nak bila anak saudara bila anak saudara saya minta saya mengajar dia, walaupun ABC, saya tak nampak nak tolong dia. Sangat menyedihkan, sangat kecewa. Dan saya sangat rapat dengan anak saudara saya. So bila berlaku macam tu, sangat sedih. Macam itulah. Masa tu kaki bengkak, and then bengkak sangat kat sini doktor tu check, ingatkan saya untutlah apalah, tapi tak pergi fokus pada pinggang masa tu. And then bila diorang dapat bacaan kreatin, memang terus nak buat dialisis, dan dapat pastilah saya ada masalah buah pinggang. And then kita dalam proses lah untuk buat dialisis dan sebagainya. Dulu saya seorang yang aktif. Saya seorang yang yalah kesana kesini, travel dan apa semua. Dan makan pun memang tak kisahlah. Tapi saya dapat diagnose diabetik apa semua tu setelah 10 tahun tu. Dan bila keadaan semakin teruk, baru kontrol lah, dah tak minum air gas. Bila lepas operation tu, I'm expecting normal view, tapi tidak. Dan doktor cakap, okay, you are not going to have the same view after this. Jadi saya macam redha lah.
Macam sekarang dia dah tak boleh berjalan, dia akan cepat sesak nafas. So saya akan guna wheelchair untuk tolak dia. Most of us, kita cuma tahu kalau diabetik tu potong kaki. Itu yang paling common yang ada lah. Tapi untuk attack ke mata tu, that time kita memang tak tahulah. So
tidak mempedulikannya lah.
Satu tak pedulikan, satu lagi masa tu kita just anggap selagi tak kena kat kaki, it's okay.
Saya pesakit kronik, tapi dialisis tak sakit, kencing manis tak sakit, mata tak nampak tak sakit. So saya tak rasa saya sakit. Dan bila kita rasa tak sakit, kita ignore. That's one thing. Pasal diabetes ni, orang ramai ignore, tiba-tiba kena potong kaki sebab ignore. Sebab tak sakit. Kita ni kalau selagi tak sakit, tak pergi cari doktor, tak pergi makan ubat. Sebab tak aware yang benda tu semakin rosak kat dalam.
And we are live. Hi, good evening, ladies and gentlemen. Selamat petang semua. Thank you so much for tuning in, for spending your evening with myself, with Dr. On Call. We are now at 53 live viewers. Do invite your friends and family members to come on board. For those of you who have watched the short clip earlier, I think that is really heartwarming to watch and see what happened. And I think the part that really struck me was when that lady said, saya tidak sangka yang saya yang selama ini sihat akan ada diabetes atau kencing manis, right? And we saw that 1 in 5, or about 20% of Malaysians have diabetes. And now from that video, we saw how it could really make life so difficult for the patient and everyone else. So I'm very glad today to be hosting all of you. And we are going to have on board today a very special guest, right? And maybe our moderators can put up the theme for today's topic. Do invite your friends and family. We're going to have a good time tonight talking about the myths about diabetes. And I just want to greet some of the people who are here. Hi, Faisal. Nice to meet you. Norazni. Thank you for dropping by. Normaya, Nurul, Radia. Thank you very much. Angelina. Yes, we are looking forward to share as well, right? So do get your friends to come in. Do share this. I think this is going to be a very interesting session. We have with us today one of the most sought after doctors in the Klang Valley who treats diabetes, right? So without further ado, let's get the ball rolling.
Hi, good evening.
Hi, good evening, Dr. Chooi.
Yes,
How
hi,
are you
Dr.
today?
D. Okay, I'm good.
All right, so ladies and gentlemen, we have here with us Dr. Chooi, who is an endocrinologist from Pantai Specialist Hospital.
Ampang Puteri, KPJ.
Sorry, Ampang Puteri, KPJ. Got myself mixed up. So sorry.
No problem.
Yeah. So, while our friends who are here inviting some of the other family members, I normally like to ask my hosts, the guests who come onto our show, especially now that we are in this COVID era, what is it that you miss most of all from life before COVID? And what are you looking forward to?
Life before COVID, sebelum COVID melanda kita, I think the thing that I miss the most is traveling. Be it with family or to attend conferences overseas, to get to know people, to learn in person the latest and greatest about updates in various things, including diabetes.
Yep.
Now everything, as evidenced by today, is online. So it's a bit different, but we have to embrace this new norm for this time.
Correct. And I believe, it's every one of us, correct, is having to learn how to live life again at every level of society, correct? Yeah. So, Dr. Chooi, we have quite a crowd that have joined us today. Hi, Hayley, Farida, Putri, nice to meet you.
Hi,
Helena,
everyone.
David. Yeah.
Thanks for coming.
Maybe to just warm things up a little bit, can you share with us, like you are an endocrinologist, the sugar doctor, not sugar daddy,
so to speak.
right? So most people think that endocrinologists, what they do is they only look at diabetes, but you do so much more. Maybe you can share with us a little bit about yourself, and so our audience can really get to understand what do you do, and if they have any questions, they can post them on board, and we will try to address all of them. Great. Over to you, Dr. Chooi.
So thanks. In my role, I'm an endocrinologist, diabetologist, as well as a physician in general internal medicine. So bukan saja tengok diabetes, tetapi all the other hormonal issues as well, including thyroid disease, which is pretty common, as well as gonadal problems, adrenal problems, as well as electrolyte imbalances, sodium issues, and also hypertension, cholesterol problems, bone issues like osteoporosis as well, calcium issues like hyperparathyroidism, and the list goes on. Obesity is also one of the things that I am managing as well. And basically, I can't expect what I will see in clinic because there's a wide spectrum of conditions that I see. People walk in, and also my colleagues in hospital will refer to me as well. So it's a very big mix of things. And of course, when I'm on call, I also see general medical patients. I manage dengue, and also now COVID patients as well in this era.
Wow.
So it's a
You got
learning
your
curve
hands full.
of everything. Yeah.
Yeah, you got your hands full, right? So, ladies and gentlemen, I think if you come and see Dr. Chooi, he will really cover everything holistically. And I think, and now let me guess, right? Like, because you look into the hormonal system and many of the internal systems in the body, I guess is one of the number one complaints that people come to you will be selalu penat,
Yeah.
right?
Yeah.
Half the people
It's-
that come through doctor on call's main complaint is selalu penat.
Yeah. So we have to tackle this, as you say, holistically. There are memang banyak sebab yang akan menyebabkan seseorang itu penat lah. There are many reasons. So we have to look hard lah, basically, to find whether there is really an organic issue, a biochemical issue that can be settled lah.
Yeah. So I also, there are many reasons why, people selalu penat. For me, it's when my wife asked me to wash the dishes. Then I also very penat.
Yeah, same. Sometimes when the patients tell me that they are penat, I also tell me, saya pun.
All right. So, Dr. Chooi, what are we going to be talking about for the next 1 hour? Let's just jump right into it, right?
Sure. So basically, is there more to diabetes than just sugar? Yeah, question that we all want to answer. There are many myths, misconceptions, and queries. A lot of things people are not clear about with regards to sugar.
Yeah. So, and I think that's the main thing that everybody equate, right? Like, I don't take so much sugar also. How come I have diabetes? Padahal when we go mama, then Milo, 3 sudu pekat kau tambah.
Yeah.
Right.
But it's more than just sugar intake.
Yes, and it affects so much more of our body. I mean, when I was learning, my professor used to say that diabetes is the mother of all illnesses. Is that right, Dr. Chooi?
There are many diseases that are mothers of many other illnesses, but true, diabetes actually will lead to, if not taken care of properly, to many, many other conditions that will encompass a wide spectrum of specialties. That's why I work together with many, many colleagues to co-manage patients who ultimately end up with complications of diabetes. It is not diabetes yang menyebabkan seseorang itu merana ataupun ada sakit, but as evidenced by the patient in the video, ialah komplikasi kencing manis yang menyebabkan seseorang itu mengalami banyak masalah atau kesusahan ataupun kesakitan pada masa hadapan. That's the problem if not taken care of properly.
Exactly. So, hi Shafika, Sally, thanks for coming on board. So, ladies and gentlemen, we are going to jump right in soon. So, do tag your friends, do share this video. I think it will be very beneficial to everyone. In fact, it may save some lives. Now, I'm just going to give you all a bit of a hint because thank you for joining us tonight. We are going to have a mini contest, right? And Dr. Chooi, would you like to move on to the next slide and show us what this contest is all about?
Okay, now, let me see. Yes, I can do that. Okay.
All right. So, for you guys who are seeing it here, now this event is sponsored very graciously by AstraZeneca and also Asian Parents, and is hosted by Dr. On Call. And I think by now, most people know who AstraZeneca is already. Thanks to the hashtag, cucuk my ass. Am I allowed to say that? But, so we are very, very thankful that we are taking this time to educate the public and to encourage everyone to come on board, learn and spend time. We are giving away, or rather my bosses are giving away, a health screening package. So, rakan-rakan sudah lama tak pernah buat health screening, tak tahu apa pun health screening, tak pernah buat ujian darah, takut diabetes. Stay tuned. Somewhere in the middle, right? Dr. Chooi is going to talk about the topic, and I will be asking 3 questions, somewhere in the middle. And once you find out what the 3 questions are, do type, once you find out the questions and the answers, of course, do type it into the comment below, and someone will select you, and we will tell you how to redeem your prize. So we are going to send a nurse all the way to your house. Out of the thousands of people that's going to watch this clip, we are going to send a few lucky winners, I think 4 in total, who will, do your blood test for you, find out if you have diabetes, and match you up with the doctor's consult. And if you really need extra help, Dr. Chooi is always available, right? So stay tuned, get your friends to join in. And we already have some questions, right? Thank you, Han. There's a 74-year-old gentleman with slight diabetes. Now, Dr. Chooi is going to dispel the myth. Is there such a thing as slight diabetes? And what are the tips for sugar control? So without further ado, over to you, Dr. Chooi.
Yeah, thanks. Thanks for the questions. I think some of them will be answered during this section. So stay tuned and let's move on. Let me just try to move the slides if I can.
Yep, go ahead. Guys, post your questions here and we'll try to address them.
Okay. Now, sorry, I need to actually get my cursor up to the other side.
No worries. You just say hi to the... Dr. Chooi, I think you would have to reconnect again. Oh, okay. So I think Dr. Chooi dropped out the call for a while getting his slides on board. But in the meantime, do keep your questions coming. Do tag and share and get some of your friends on board. And I think, diabetes is a problem that most of us encounter. Right? Most of us have someone in the family we know that has diabetes, right? Including my own father and my grandmother as well. And if it's not managed well, it really affects the quality of your life, right? And I think I wasn't just joking when I say that people who have diabetes selalu penat badan, which is true, right? You find that individuals who have diabetes has a deranged or metabolism dia sudah rosak. So you always feel tired. And it inhibits us from experiencing the best of life. All right, Dr. Chooi is back.
Yeah, sorry, I clicked something wrong and I need to go back to my slides again.
Yeah, no worries. I was just telling them that, diabetes really robs away the best of life that we can have. And having it well controlled is really like becoming a new person.
Yeah, definitely. Now, okay, you can see my slides, yeah?
Fantastic.
Okay, great. So let's move on. Sorry about that.
No worries.
Number of people with diabetes is increasing. We know that for sure. The estimated global prevalence of diabetes increases year by year. In the year 2011, it was 366 million, and now it is projected to reach 552 million by the year 2030.
Wow.
And it's actually increasing very rapidly in our part of the world, in the Asian region, so much so that Time magazine actually labeled diabetes as the possible Asian disease. And in Malaysia, we are not spared this pandemic of diabetes. In our latest National Health and Mobility Survey, 3.9 million people aged 18 and above have diabetes in Malaysia, which actually translates to 1 in 5 adults in Malaysia. Wow. And if I could draw your attention to the prevalence of diabetes by age groups, the worrying thing is that the large proportion of younger people actually did not know that they have diabetes, most likely because they have not gone for any screening and also that they were not having any symptoms. And having diabetes at a young age is not good because you have a longer time to deal with this disease and to also start to experience complications from the condition.
Wow. So Dr. Chooi, just to pause there and impress upon the numbers 1 in 5. That means if we were to imagine like how in the past before COVID, we go hang out in the mama, and there is 8, 9 of us, it's possible that one of our friends in front of us could have diabetes and could go down the track of, the unfortunate lady we saw in that video earlier.
Yeah,
and that's right. And that's sobering, right? everybody thinks that it could never be me until
Yeah.
it is me, right? Yeah.
It's true. Everyone thinks it cannot be them, because in the few months that I've been in working in my new hospital, I've had number of young patients. Even a recent one was a 24-year-old Malay lady
Wow.
who never knew she had any issues. She came in because of other problems. She had abdominal discomfort and whatnot. When she got screened, she was actually having an HbA1c of 11%, which is a
Wow.
very high level, if you know what I'm talking about. The blood glucose level at the time was 45, and our normal level is not beyond 10, actually. So it was actually already quite severe by the time she was diagnosed. And there have been other people who have had diabetes when they were younger. Some of them actually came into under my care because of viral fever, because of dengue. And looking at their condition, maybe their body weight and also their initial blood sugar on admission, I actually screened them properly and found that they have either pre-diabetes or diabetes as well, which was
Wow.
something that was shocking to them. So, yeah.
Yep.
So you're right. In your group of friends, there may be one or two who are diabetic and they don't even know it. So moving on, in this present day in COVID-19 as well, having diabetes has actually also been proven to be associated with increased mortality with regards to COVID-19.
That means more
know
death.
for a fact-
That means more death, right, Dr. Chooi?
Correct. We can see that even from the statistics from last year and even until now, if you've been following, many of the people who have passed away, unfortunately, from COVID-19 have many other related health issues. For example, high blood pressure, diabetes as well, in addition to possibly kidney disease, heart disease, and obesity. And I can see this for a fact in my small patient cohort in our COVID ward as well. The patients who tend to deteriorate, who tend to require oxygen, who tend to need ICU admission, more often than not are diabetic patients as well. So, yeah, this is something that we need to take note. And one myth that, or one thing that has been always going around is that, I pose it to you. Do you think that diabetes is caused by eating too much sugar? So a lot of people think that if they don't take any sugar, they won't get diabetes. But in actual fact, it's not entirely true, because diabetes is more than just a single disease. Actually, there's type 1 diabetes, for example, which is an autoimmune disease. It is contributed to by genetics as well as unknown factors that trigger its onset. And even if you don't take any sugar, you still have glucose problems. And type 2 diabetes is caused also by some degree of genetics as well as lifestyle factors, being a multifactorial disease.
But when Malaysians say they don't take much sugar, it's hard to believe. Probably they don't put the sugars, they don't scoop it in.
But there's a lot of sugar in the food as well already. If you take processed food, if you take canned food, if you take sauces, it's all already in there. Okay. And there's a lot more that Malaysians don't know. For example, satu dalam setiap 3 orang, they will believe that cutting down on sugar is enough in order to prevent diabetes, and about half of patients think that diabetes is not hard to manage. Well, if you manage a diabetes clinic, you know that that is not true. And 52% of patients do not know that diabetes cannot be cured. It's actually a chronic disease. It's not a matter of taking medication for 2 months and then after that it goes down and you can stop medication. It's not like that. Diabetes cannot be cured, but you can possibly control it better. And in some cases, there may be what we call remission, especially when there is a very, very concerted effort in terms of lifestyle as well as exercise and diet control. But cure is probably something that I wouldn't dare to say.
So Dr. Chooi, before that, Ashoka asked an interesting question.
Okay.
And, mentioned that there's an increased number of diabetes among children.
Yes.
And that's interesting. Is this a new thing? Is it that we are hearing it more often, or is it really the incidences are happening more? And is it due to genetic, or is it something to do with their lifestyle and the snacks and
This multifactorial. There are many factors that lead to this. The prevalence of type 2 diabetes in children and adolescents has been increasing year on year in many countries that have undergone urbanization and industrialization. more than one factor will contribute. Some of them have a genetic tendency, definitely, because of family history. There are some genes that work against them, so predispose them to developing the condition. And of course, having a more sedentary lifestyle than previously, where we spend more time online looking at the computer, now it's even virtual studying, right? Rather than going out running in the field and doing things that probably people in the past used to do more. I wouldn't say myself as well, but yeah. So, and of course, the type of food that is being taken as well, more processed food, more junk food, more of sweet drinks, more bubble tea, etc. And this all contributes. And you can see that the weight as well. In Malaysia, the prevalence of overweight and obese children is also increasing. But bear in mind, there will be some lean diabetics as well.
Yeah.
So it's not that if you are thin, you definitely will not get diabetes. Just that your risk may be lower. You may be less predisposed, but it does happen as well.
So since we were talking about food, right? So Faisal asked the elephant question in the room today. And Dr. Chooi, you and I are going to offend all the Malaysians here. Rice. Does rice adds to sugar consumption? Our brother Faisal.
So yes. So you can see that, in certain parts of the world, for example, in the West, they may look bigger than us sometimes. Even they are heavier and whatnot, but their rate of diabetes is actually lower. We are genetically predisposed as Asians, unfortunately, to be more prone to getting diabetes, and also because our diet is more towards the carbohydrate base. We take more rice, noodles, kway teow, and whatnot. And definitely, rice does contribute to glucose excursion or increase in the blood glucose level. Of course, there will be some forms of rice that are slightly better. For example, parboiled rice, brown rice compared to your refined white rice, which actually shoots the sugar up faster.
And some people say basmati rice, right?
Yes.
All right.
So that's true. Okay. So now, if you think that you are very sad because you have diabetes, don't be too upset because you're not alone. Even one of the highest paid actresses in Hollywood previously, Halle Berry, is also diabetic, and is still able to lead a full life, doing lots of things that we would never be able to dream that we are able to do. And other famous people as well. Now, I'd like to ask you, what do these people have in common? Vanessa Williams, singer, Nick Jonas, and
they all look very good.
Yeah, they do look good, even Theresa May as well. Now, what do they have in common? Actually, all these people actually have type 1 diabetes. And some of them are even on insulin pump treatment while they're at it doing their work in their careers respectively. And how about these people? Randy Jackson, Tom Hanks. Now, these people have type 2 diabetes as well. And they've sometimes shared about their journey with diabetes with their fans and followers also. So don't think that you're alone. Many people actually have diabetes, or whether they know it or not. So don't be in despair, but we can find a way to control the disease better. Now, there have been many myths and many misconceptions about diabetes, which led to me actually writing an article in the Star to try to address some of these misconceptions. Like, for example, will diabetes drugs damage my internal organs, etc.? So feel free to check out my blog and website to actually access these articles.
So we will share Dr. Chooi's blog online, and then all of you can check it out. But on that note, Eddie did ask an interesting question, right? So there's a bit of a perception that insulin versus pills is one of them better than the other, right? So maybe we can clear that,
Can? So there are a variety of medications available to treat diabetes, both oral as well as injectable. So insulin is not the only injectable nowadays, but we can actually tailor-make or individualize the treatment regimen for each patient, because we now know that it's not just a single stepwise treatment where you start the first pill and then the second pill and the third pill, and all else fails, you go for insulin. We actually can target the appropriate treatment to each patient based on their profile, based on whether they have certain characteristics. For example, are they overweight? Are they obese? Do they have a history of heart disease? Do they have kidney problems? And etc. So we actually will do the consultation with the patient on an individualized basis, and then we discuss with them the treatment options, and we try to suggest the one that is most suited for the patient in front of us.
Yeah.
Okay. So moving on to diabetes itself, diabetes mellitus, what does it mean? Now, this term is actually derived from the Greek word diabetes, meaning excessive discharge of urine, and the Latin word mellitus, meaning honeyed or sweet. Now, in the past, before we had these modern testing methods, doctors would actually taste a patient's urine if they suspected the person had diabetes. Now, I'm very happy that I do not have to do this anymore, thankfully. There are other ways to screen for diabetes that I will share with you later. And ancient Indians actually tested for diabetes by looking at whether ants were attracted to a person's urine as well.
Wow. Fantastic.
Now, moving on to risk factors for diabetes, what are the factors that would predispose someone or increase the risk to someone to have diabetes? Yeah. Of course, it can affect anyone, but there are some factors that would make someone more likely to have diabetes. For example, if a person is overweight or obese, you're more likely to develop type 2 diabetes. If you lead a sedentary, inactive lifestyle, or you have a parent or sibling with diabetes, a family history that's significant, you are also more likely to develop this condition. Age also plays a role. The older you are, the more likely to have diabetes. And if you are a lady who has ever had a history of gestational diabetes, you may have a higher risk of developing diabetes. Having impaired glucose tolerance or impaired fasting glucose, which is what we call pre-diabetes atau pra-diabetes, or abnormal blood cholesterol levels or high blood pressure, hypertension, you also have kecenderungan yang lebih tinggi untuk dapat kencing manis as well.
So, Dr. Chooi, what is gestational diabetes? I think some in the audience
Gestational
are a bit
diabetes
curious.
is a condition where ladies actually have abnormal blood glucose levels during pregnancy. Yeah. So semasa kandungan tu rintangan terhadap insulin tu bertambah because the placenta produces certain hormones, and if you are predisposed to it, you might have glucose levels that are higher than certain levels. And if you have gestational diabetes diagnosed, you are at higher risk for complications semasa kandungan. That's why we will actually treat patients to achieve stricter targets than what you have during if you are not pregnant. Yeah.
Wow.
And actually, for more information, you can actually check out my YouTube channel. Just type my name, Chooi Kheng Chiew. I have a video there on gestational diabetes as well.
Fantastic. All right, so I'm going to interrupt for a while. For those who
Sure.
join us from the very beginning, I mentioned that we are doing a giveaway of health screening. So this is question number 1. What are the risk factors for diabetes? Question number 1 out of 3 questions. We have it here, and we're just going to leave it on for another 5 seconds. 4, 3, 2, 1. All right, let's move on.
So I'll move on.
Yeah.
Okay. Now, move on to the symptoms of diabetes. Now, I don't want to mislead people. Ada orang yang memang tak akan ada apa-apa simptom pun. The first time that they know they have diabetes is when they develop a complication atau masuk hospital with a big problem like heart disease or stroke. Yeah? But there will also be some people who have symptoms that could be suggestive of diabetes. So if you have these symptoms, it should trigger you to actually seek help, to get screening done, or to seek a consultation with a doctor. Yeah. Some of these symptoms may be mild, some more severe. Yeah. If the more symptoms you have, the more likely that it is going to be significant. So among these symptoms are having blurring of vision, kabur mata, selalu lapar, selalu dahaga, minum banyak air, drinking a lot of water, and also passing a lot of urine. Yeah. Even sometimes waking up at night multiple times to pass urine, ataupun berat badan turun walaupun makan banyak. And another thing is feeling tired again. So this tiredness can be a sign of many conditions, including diabetes as well. Other symptoms would be kebas-kebas tangan kaki. This is because the nerves are affected. And also poor wound healing. Bila ada luka, susah untuk sembuh. And feeling of nausea or vomiting as well.
All right. So
Yeah.
maybe let's just let the audience know that this is question number 2. Okay.
Oh, okay.
So
Sure.
the question number 1 was what are the risk factors. This is question number 2. What are the symptoms of diabetes? So I know everyone is very eager to type it in, but hold it all in and just submit it all in one go because there's 3 questions, right? And possibly the next slide would be the third question. So give an answer, one example of risk factor, another example for symptoms, and then we hope that you get selected to for our lucky winner for our health screening test. All right, over to you back again, Dr. Chooi.
Sure. So I'll move on. Now, the thing is, diabetes by itself, the high blood glucose levels are not the thing that kill a person or cause harm to a person directly most of the time, but it's actually the complications of diabetes. So my role, I see it as more of preventing complications by treating the patient well, helping them and guiding them in their journey with diabetes. Now, what are these complications of diabetes? Now, there are various complications that I'll share about in the coming slides, but in this survey that's done in Malaysia, many people know that diabetes leads to problems like amputation, for example, potong kaki, because the toes are not healthy, there's infection, and then they lose part of their leg. And also masalah mata as well, diabetic retinopathy, eye disease, even kidney damage and nerve damage. But some people don't know that it actually can contribute to heart disease as well, which is the leading cause of death in Malaysia, the deadliest cause of death, which is cardiovascular mortality. Yeah. So, the macrovascular complications of diabetes iaitu komplikasi yang melibatkan salur darah besar dalam badan, which is macrovascular. For example, will be stroke and also heart attack, masalah jantung, coronary, and also reduced blood circulation to the peripheries, or what we call peripheral artery disease. And next would be microvascular complication atau komplikasi yang melibatkan salur darah kecil dalam badan, which will lead to things like diabetic retinopathy, and also lead to blindness, like what you saw in the patient in the video. This sometimes happens silently, quietly. Patients don't have pain from this condition. That's why it's important to get screening for retinopathy if you get diagnosed with diabetes, because there may be already problems at the back of the eye that predispose you to bleeding and also possibly retinal detachment and mungkin kehilangan penglihatan. Yeah, so it's a leading cause of blindness in working age adults actually around the world. And masalah kidney atau masalah buah pinggang, this is one of the things that the patients tell me they're the most afraid of. Paling takut ialah perlu dialysis. Yeah? And sure enough, in Malaysia, the leading cause of patients requiring dialysis is actually diabetes.
Wow.
And masalah saraf or neuropathy, causing patients to have numbness, they don't feel their toes, mereka tak rasa sakit kalau ada luka, and this is the problem that patients have. Mereka ada luka sikit, mereka tak rasa, end up having infection, abscess, then it's too late to save the toe or the foot, kena potong kaki. That's one of the conditions. And also erectile dysfunction, something that our male patients sometimes are shy to share with us. They have problems with sexual intercourse, with erectile dysfunction, and the possible cause could be actually diabetes. Yeah, because diabetes affects both the nerves and the blood vessel. So not enough blood supply and nerve problems, autonomic nervous system issue, erectile dysfunction can be a complication as well.
So Dr. Chooi, I think it's good that we emphasize on this, right? And interestingly, this is also, ladies and gentlemen, our third question for the day, third and final question for the day. What are the complications of diabetes, right? So, and I think, Dr. Chooi, myself, and the organizers, we really we put these things in because we want to make sure people pay attention to it, right?
Yes.
Because of how important it is. So question number 1, what are the risk factors? Question number 2, what are the symptoms? Symptom. Question number 3, apakah komplikasi diabetes? And I think, Dr. Chooi, that is where it really opens up, right? That you could lose your eyesight, you could have to go for dialysis, if the diabetes is not controlled. And I think a lot of men are concerned about erectile dysfunction. Yes. And wow, 75% of men with diabetes, right? And that's why it's really important that we resolve it.
Yes.
Okay.
Now, if you have time, I'd like to just show you a recent patient I have. I'll just show you. She came to my clinic 2 or 3 weeks ago with, of course, poorly controlled diabetes. And then she took off her sock to show me her problem that she was facing. And she actually showed me her toe. I hope you can see this, yeah? I hope I'm putting this correctly.
Yeah.
So this was her toe, which is already black. She told me that a week ago, she actually knocked her toe and injured it, but then she did not treat it, did not go to see a doctor. And this toe ended up becoming gangrenous, black, and in the end had to be cut off actually.
Wow.
Because she did not feel the pain from it. So she tak rasa sakit actually. Yeah. So that's the problem.
And that's very unfortunate.
Yes, that was really unfortunate. Okay. So now let's move on. Okay. Right. So the importance of early detection, I can't emphasize further. It's really, really important to control, to detect the diabetes early. Yeah. Why? Because patients can start to manage the disease earlier, and they can potentially prevent or delay the serious complications that can decrease the quality of life and even decrease the quantity or length of life. For example, dalam kajian ini yang dilakukan di negara UK, in UK, you can see that the number of patients who were screened and had treatment implemented without delay, there were a lower risk of actually suffering from stroke or requiring a heart bypass as compared to patients who actually had a delay in diagnosis and therefore a delay in treatment. They had higher risk of suffering from complications seperti stroke dan masalah jantung yang memerlukan bypass. So that leads to our discussion on testing for diabetes. How do we check or screen for diabetes? Now, the most common test that we usually do in outpatient setting, in fact, in most of your screening blood tests in the panel, in the clinic, in the lab, they will have this thing called fasting plasma glucose. They'll say, kena puasa dan datang ambil darah. Yeah? The benefits of this test is very cheap and widely available, but single point measurement, maksudnya you take this blood test at a single point in time, may not accurately depict the overall glycemic control. And what do I mean by that? Is because sometimes when patients know that mereka akan pergi buat screening, for the few days before pergi jumpa doktor atau buat blood test, mereka akan ikat perut, tak makan. They will become super very disciplined for those few days. And then sometimes they will have a very nice fasting plasma glucose because that day the blood glucose cantik sangat, right? So it will fail to detect problems actually for some people. So we have another test called HbA1c, which is glycosylated hemoglobin. It actually more accurately reflects the average glucose control over 2 to 3 months. And we also use this as a marker of monitoring of control as well when patients come for follow-up. So yang test ini memang tak boleh tipu orang lah, because even though you ikat perut for 3 days, 7 days and whatnot, if your blood glucose has been high for the past 2 to 3 months, it will still be high lah. Yeah, and it can also be used for diagnosis as well. So leading to the diagnostic criteria, macam mana kita nak diagnosekan ataupun confirmkan seseorang ada kencing manis. WHO, World Health Organization have their criteria, American Diabetes Association have criteria, our own Malaysian CPG atau Malaysian Clinical Practice Guideline for kencing manis also have our criteria. Pretty standard across the board. Fasting plasma glucose, if it is 7 or more millimoles per liter, considered diabetes, if repeated and 2 times positive. 2-hour plasma glucose atau selepas minum air gula, this oral glucose tolerance test, if it's more than 11.1 millimole at 2 hours, also considered diabetes. But as I said, HbA1c can also be used for diabetes now. For us, if it is 6.3% or more, it's considered diabetes as well. Yeah.
So in short, Dr. Chooi, it's all we need is a blood test, right?
Yes.
To really find out early whether we are at risk. So there's no reason. So there's no reason why everyone should not get themselves, checked and tested, especially once they reach a certain age. So
Yes,
Dr. Chooi, what age do you think now we should begin to consider getting a blood test?
Actually, the age of getting diabetes, as I said, is actually getting lower and lower. So even if you're 30, it's probably time to start screening, especially if you have risk factors that I've mentioned before, family history, being overweight, obese, and whatnot, or you have hypertension, cholesterol problems. Yeah.
Wow. So let me pause you there because Nikki asked a
Yeah.
question. Right?
Yes.
If someone has family history, we're talking about family history, how likely is the person to have diabetes? You
It's very difficult to put a specific number on that because there are some people who, even though they have family history, they might be the only one in the family who doesn't have diabetes or not yet achieved that, maybe at a later age, whereas some people, they develop it very young. So
Yep.
we can't say that there is a certain percentage for sure, but definitely with a family history, the chances are higher than someone without a family history.
So Jaspuvan has a follow-up question in the sense
Okay.
that in that case, let's say I
Yeah.
know, will lifestyle
Yeah.
management, right? Will lifestyle help me in that? Will it change my fate, so to speak?
It will help you. It will help
Right.
you, but if you are very predisposed, you are a lot of odds are stacked against you, you have a strong family history, etc., you may still get diabetes, but maybe at a later age.
Wow.
So the importance of a healthy lifestyle is, of course, to be emphasized. It could probably delay the progression of diabetes, delay the onset of diabetes, delay the severity as well, reduce the severity of diabetes. Yeah. So don't discount the benefit of having a healthy lifestyle. Yeah.
All right.
So
Great.
disease progression now in type 2 diabetes, even before someone is diagnosed with diabetes, we know from various studies that there has already been progressive loss of our pancreatic beta cell function. Yeah, even before the diagnosis is made, someone already starts to have a decline in beta cell function, and as time goes by, as age creeps up with us, the disease continues to progress. That's why it's important to control it early on. Some people said that we delay it because sekarang saya tak rasa sakit apa-apa, tunggu next year or the next year, following year, baru kita nak focus on it. Saya masih muda, but it's not true, because if you don't control it early, you live longer with the poorly controlled blood glucose, you end up with more complications as well. And from a very famous study, the United Kingdom Prospective Diabetes Study, we know that improving glycemic control atau kawalan gula yang baik will actually reduce the risk of long-term complications. Yeah, every 1% reduction in the HbA1c can reduce long-term complications like stroke, heart attack, heart failure, and also microvascular disease like I've shared, kidney disease, eye disease, and nerve disease as well.
So while we were on the topic of control, Kinjo
Yes.
asked an interesting question. The
Yeah.
ketogenic diet,
Yeah.
quite a bit of a trend these days. Does it
Yeah.
help to control diabetes? The
The thing is,
ketogenic diet.
with diets, right, in general, diets that can help you to lose weight, to reduce the calorie count in general, there are various diets out there, Mediterranean diet, keto diet, etc. As long as someone can actually comply to the diet long enough and persist on with it and achieve a negative calorie balance, it's actually
It's
a
good
good
enough.
diet to be on.
So-
Because the problem with many diets is that people are half-hearted, or they very gung-ho at the early stage, but after a while they just forget about it or can't continue. So then that is not a successful diet. Diet plan.
So
Yeah.
it's not about which diet, but actually
Yeah.
staying on it.
There are many diets that can be possibly adhered to that can improve, but you need to actually stay long enough. and
So
adhere
Dr.
to it.
Chu, do you see that there's an improvement among our
Yeah.
Malay friends, especially during the fasting month?
Yeah. Okay, there will be two sides of the coin. There will be patients who actually get controlled better if they actually comply to the normal diet advice and also do the fasting as per usual. But when they break fast, they are also careful with their food. On the other hand, there are also some patients, unfortunately, masa puasa itu, they really control. But when they buka puasa, they
The
go
waterfall.
they go like, they will take all the minuman manis, the syrup, and all the kurma and all the sweet dessert, and after that continue on with bubur and all the dessert after their tawarik prayers. So they tell me that they take even more food, during that time, and it's not good lah, basically. So, but the patients who have been disciplined and really adhere to the advice and do the fasting, actually they do get weight loss and improvement in the glucose control as well, in addition to the medication that we give. So
Great.
yeah, you still have to be disciplined.
Yeah.
So in overview of diabetes management, this is just a very bird's eye view to just talk generally. first of all, we need to have targets for control. Humans are very target-based. Kalau tak ada bagi target atau sasaran, right, no KPI, we will just be blindly like saying, yes, I will do better, but there's nothing specific to be done. That's why we set targets for patient to achieve, so that we got something to show them that they are getting better, or if they're not hitting target, what they can do to improve. So we have targets for blood glucose, blood pressure, cholesterol levels as well. And lifestyle modification, of course, is important, diet, exercise, and we have many medications available to treat patients. Our goal in the end is to avoid adverse events and complications. So our aim is to maintain an A1C level, meaning maintain the blood glucose well, maintain blood pressure, maintain the cholesterol too, through a mixture of medications as well as diet. And hopefully this would prevent diabetes from coming in, or to manage diabetes well and delay complications also. For patients who are overweight or obese, we always recommend weight loss. It is important and it is beneficial. Kalau seseorang itu boleh lose about 5 to 10% of their initial body weight, it will be good within the first 6 months. And we can help you to do that realistically. There are certain medications that we have for diabetes that are more suited or would be more beneficial for patients who are overweight or obese, because di samping mengurangkan gula, they can also help to lose weight as well. Yeah. So physical activity memang penting, but don't go overboard. If you have never done any exercise in your life, don't go and suddenly go and run a marathon. Yeah, increase gradually, slowly, at the rate that is safe. Yeah, because you need to actually sustain this long, and we don't want you to have complications from sudden excessive exercise as well.
So, Dr. Chooi, when it comes about exercises, are they
Yes.
all created equal, right? So some people do weights, some people do
Yeah.
HIIT training, and some
Yeah.
people go jogging, and some people go to the
Right.
park and they swing like that, and then they say I've exercised, right? So let's be realistic about it,
Yeah.
Dr. Chooi, and share. So what matters in exercising?
The best is to have a mix of different exercise, aerobic as well as the resistance training. So
I see.
for the cardiovascular one that will actually help to sort of like reduce your weight and all, most of the time is actually at least moderate intensity exercise, meaning the type of exercise that will get you a bit breathless. For example, brisk walking, yeah, and it needs to be of a certain duration and frequency also. So we generally will recommend at least 150 minutes a week, spread out to at least 5 days a week, no more than 2 consecutive days without exercise. So if you use this equation, it's roughly about 30 minutes a day, 5 days a week of moderate intensity or more. So it's like brisk walking, etc., with several episodes of resistance training and weight training put inside there as well.
Or for the busy people taking the stairs instead of the lift.
Yeah, definitely. Just take stairs. Yeah. Last time in UM, I used to climb 14 flights sometimes.
No wonder you're so fit.
No, it's because during COVID time, the lift is limited in the number of people who can
yes.
go in. And of course, we prioritize patients. So the doctors will have to sacrifice that. Okay. Moving on. So another important thing that I tell my patients is that smoking is very important to stop. Yeah. Stop smoking, because it definitely increases the cardiovascular risk. Especially if you have diabetes, you already have a higher risk of heart disease and stroke. And moving on to self-monitoring of blood glucose, this is something that I always emphasize. It is important. Yeah. So why is it important? Because if you monitor blood glucose yourself, you get immediate feedback on how your blood glucose levels are affected by medications and also food and other factors. So there are various ways to do. Generally, the common way is you use a glucometer, for example, like this, or many other glucometers in the market. You will see. I hope you can see this. You can see me showing this, right? Yeah. So basically, you use this. You prick your finger, and then you get a drop of blood, and you put it there, and you can see your capillary blood glucose at that time. Or for some people, you may actually want to consider using continuous glucose monitoring, flash continuous glucose monitoring, where you can actually scan, right? And you can actually get your blood glucose level at that time. Yeah. Now, why is it important is that so that you can actually titrate the medications, you can let your doctor know how you're doing on a daily basis, and also you know for yourself what food will impact your blood glucose in what manner. So you can try, for example, a lot of questions about what food to eat, what rice and etc. Now you can actually do the testing on yourself. You can check yourself, say, before you eat the meal. And then you can take the food that you're accustomed to, or you want to try certain type of food, you check your blood glucose 2 hours after eating. And you can see how high the blood glucose goes up.
2 hours
Yeah.
after eating, yeah, everyone. So 2 hours after eating.
Yeah, usually that
check your
is what we advise people. Yeah. But if you have continuous glucose monitoring, you can actually scan anytime you like. But if you are pricking yourself, probably you can actually minimize that by doing at certain time points. So you can actually see, for example, I take this nasi lemak. How high does my blood glucose go after I take this? If I change and let's say I take something else, for example, I take a salad, how high does my blood glucose go up? So this will actually help you to actually gauge how you can actually modify your diet to ensure that your blood glucose is within safe limits, especially if you're diabetic. Yeah. And if depending on whether you are an insulin user, whether you use an insulin pen or you are actually taking oral medications, all this will be actually advised to you by your doctor, and of course we'll guide you to use these tools in an appropriate manner. Yeah.
So I think these are great.
Choices.
These are great tools to help with the management of diabetes. That it's not too costly. Everyone. I mean, patients with diabetes should keep one at home and really help take care of themselves, right?
No, the thing is, if you talk about cost, about costliness, now we always don't think about the hidden cost or the cost of complications. Now, what is the cost to someone if you lose a limb or you lose your eyesight or you come in with a heart attack and you have heart failure?
So true.
What is the cost to the sort of earning potential in the later years and the cost of treating the acute complication? Yeah. So sometimes we don't invest in the things that are preventive. Like we want to ensure our health is good. We may need to spend some money, but if that helps us to prevent complications, in the long run, we are probably saving ourselves much more money.
Yeah, that's true. All right.
Okay.
Yep.
All right. So what should you do? Yeah. So the call to action is that please get yourself screened. Yeah. For if you have any risk factors, or even if you're just curious, you're afraid, you want to make sure that you are safe and healthy, get yourself screened. A lot of people have been neglecting this because of COVID. To be honest, the past 1 year and 3 months, many people who have normally would have gone for some form of screening or follow-up have actually delayed. And this delay is going on seemingly forever. Yeah. In March, that last year when we had lockdown, etc., people say, okay, 3 months later, I'll get myself screened, I'll go and see the doctor. It's not happened. We have been at home for 1 year and 3 months already, and I don't know how long more. So if you don't get yourself screened, you don't know when the opportunity will come. Yeah. So get yourself screened, do blood tests that are necessary. We actually recommend doing HbA1c for patients with diabetes every 3 to 6 months, blood pressure check every visit, every year at least to do a cholesterol and kidney check, because we need to detect early. Yeah, if there's any complications of renal disease, getting eyes screen, food examination, as well as dietary and diabetes education as well. Okay.
Yeah.
So moving on, I guess you have something to share regarding this again.
Yeah. So I think we are towards our end, but I think we'll just take 2 last questions, right? And then I will just explain, and then Dr. Chooi can wrap up. So one question was that if I'm having diabetes now, right, and I'm really concerned about the complications many years down the road, right? Is it bound to happen? Or if I control my diabetes well, I can really avoid it. Like maybe 90% avoid kidney failure or retinal eye damage. Is it avoidable?
So there are no absolutes. There are some people who will be predisposed to having complications. They have very sort of aggressive diabetes, and they get complications earlier than others. But across the board, generally speaking, if you have good control, you can actually reduce the rate of complications. I've had patients who had diabetes for 20, 30 years. They are very well controlled, and they have not developed complications. It's just like a chronic disease that they manage very well. But these patients are few and far between, I would say. There are quite a lot of patients who are poorly controlled and end up having complications. That's why you see there are so many patients requiring dialysis, many patients who have required amputations in hospital, etc. don't fall in that category if you can. Control yourself well, get help from a doctor who can help you and guide you through this journey. Because diabetes is a lifelong journey, it's a chronic disease, and you need guidance along the way. Along the way, you may feel disheartened sometimes, you need the encouragement, and you need modification to your treatment regimen. It's not like the first doctor you see treats you with this medication, 1 or 2 tablets a day, and then you use that for the next 10 years. I've had patients like that. They just follow the same treatment, blindly going to the pharmacy and buying every month after month, but they did not go for monitoring, did not go for further advice, and they still develop complications and poorly controlled diabetes because at some point, sometimes the medications needs to be adjusted. The treatment regimen needs to be changed in accordance with the condition at the time.
Wow, that's great. So, okay, then the last question, right, which a lot of people are wondering about, and the question comes in 2 parts. Are there any particular food items that really help? Right. So there are the moringa leaves, bitter gourd juice, cat whiskers boiled in water. What
goodness.
else?
Yeah.
No, the plant, not
Stevia,
the actual.
Yeah. A lot of people will say that.
Do these things actually help? And how about fruits? Some people say fruits are not sugar, right? And therefore, I can drink fruit juice and eat as much fruit as possible. It's okay. So let's dispel this myth.
Now, I'll try to address this question as best as I can. Now, there are many of these traditional or I would say home remedies or things that are sort of like people will say natural ways of treating diabetes. I would say that as long as it's not harmful to you, it's not toxic or contains bad things in them, you are free to use them. But you still need to get monitored and screened because by themselves, they are not enough to actually bring your glucose down to target most of the time. Of course, having positive, things rather than negative things like artificial sugar adding on, in your putting a lot of preservatives and all, it's probably better as an alternative, but it's not going to be the key or the ultimate thing that will help you to get your sugar down to target. You still need the help, adequate medications if required, and also the required counseling with regards to diet and exercise. And with regards to your fruits actually do affect the blood glucose level also. So as I found very useful, using continuous glucose monitoring, you can see actually how the fruits affect your glucose. Definitely in our diabetes portion plate that's recommended, fruits and vegetables should be the main constituent of our diet. But be careful how much of fruit you take in one serving, in one portion at one go. I find it helpful even for myself to spread out the portion to several small portions spread out throughout the day. That doesn't cause the glucose to swing too much in one direction, doesn't go up so much. Rather, it will actually be more gradual in terms of the absorption of the glucose.
So what you're saying, Dr. Chooi, is you yourself do your continuous sugar monitoring on yourself?
Wow. I have my sensor on and I'm actually monitoring. So, for example, I can show you my trend over the 24 hours. I can show you my daily graph. I can show you my daily graph as well. So I can show you this my 24 hours yesterday. This is my sugar reading. And I use this as a tool to educate my patients as well. I show them what's the benefit and how simple it is to use. So it has helped quite a number of my patients also. But of course, the required counseling and advice. If you use it blindly, it's probably not that beneficial.
So, all right, I think we have come towards the end, so to sort of wrap up a little bit, Dr. Chooi is available at KPJ Ampang Puteri. Am I right?
Yes. That's right.
He's also available for teleconsultation via Doctor on Call. That means, if you have some questions to ask before you see him, you can always book an appointment with him first on Doctor on Call, consult him, and then, he will tell you what needs to be done, and then you can go over to his office to see him. Or if you want to follow up with him, you can also do it. Or you can also book to see him through Doctor on Call, right? And that is answering Puspa, who's asking where is Dr. Chooi located. So I think I've answered that. Now, getting themselves tested, I think is no excuse. We are really pushing all the boundaries. You have difficulty going out. We send someone to your house to do your HbA1c. And then a doctor will sort of review your results And if we think that, it's really out of order, we need expertise, then we will refer you to Dr. Chooi, who will consult you and, provide you with more in-depth advice. So finally, to win a chance of getting yourself screened for diabetes, a nurse comes to your house and do it for you. There are basically 3 questions that you will need to answer, and you can find the questions if you replay this clip later, somewhere in the middle. The first question is, what are the risk factors for diabetes? The second question is, what are the symptoms for diabetes? And the third question is, what are the complications for diabetes? So I think we want to thank everyone for spending the evening with us. We hope you have a good weekend and you stay safe. Also, thank you to AstraZeneca for bringing this event together. And of course, Dr. Chooi, the star of our show today. We hope to be able to have you on board again and maybe talk about, some other conditions next, thyroid problems,
Most happy to.
And really get into it. And I think there is a whole population who's really interested in keeping fit and how sugar control will influence muscle mass, performance and things like that. And that may be something interesting we can talk about one day. But till then, have a good day, everyone. And thank you, Dr. Chooi. Have a good weekend.
Thank you so much, everybody.
Good night.
Thank you.
Bye-bye.
In Doctor on Call, we believe that healthcare is universal. Everyone should have access to good medical advice regardless of their locations.
So during my many years of medical practice, more often than not, when we get a certain sign or symptom, not many people actually go and immediately investigate it.
At Doctor On Call, you can get connected to our network of doctors and specialists within minutes through any mobile devices, whether you're at home, in the office, or on the go.
The platform is designed so that patients can easily find the right doctors. For the doctor, we ensure that the platform is safe, secure, and they can very simply manage their patients via remotely or even in person.
By having this teleconsult, patient can actually have a continued medical care, and this can actually save their life.
As the pioneer of telehealth in Malaysia, we always believe in closing the patient care gap through telehealth. For instance, our newly launched Doc at Home service would enable patients to book physical screening and lab diagnostic from the comfort of their homes. And this is especially crucial during this time of pandemic, where we want to keep our parents, kids, and loved ones safe.
So the platform is simple enough for doctors like us to go online, do a medical consultation in between our physical patients in the clinic.
In future, this is the way forward toward looking towards the telehealth and management where we can overcome a lot of difficulties.
Now, as far as I am concerned, I can give uninterrupted medical advice to them. Isn't that easy for both parties?
During these difficult times, we strive to ensure that everyone stays safe without compromising their need for medical care, medication, as well as other healthcare services.
And also we can prescribe some of the initial medication online, so the patient can get treated to a certain degree before they come and see a doctor.
Our vision is to reshape and redefine healthcare. We believe in the power of technology To create better patient experience and continuity of care, we design our service for the patients to get the right service, right treatment at the right time.
During a pandemic like this, it is important not only that we should ensure the safety of patients, but healthcare professionals and doctors as well. Gone are the days where patients wait for hours in a long and busy clinic. These days, we want a seamless experience. Get an appointment booked online, see a doctor at the shortest possible time, and then get going with life.
We have never had something like this before. Upon doing the services, the patient will actually get their blood test done at their home, and the doctor is able to review their blood tests via Dr. On Call platform, or if required, they are called into the clinic. So that's pretty amazing if you ask me. You don't actually need the patient to come twice, once just to take blood and then come again. So it's very convenient for the patients, and my patients are very happy.